Well, appreciate the time to be here this morning and share about the work that the California 988 centers are doing. Really grateful to, I think, be part of a system that has such a clear vision for 988 implementation. And I will say that the centers have been involved and wholeheartedly agree with the vision that was shared by our colleagues here today. Next. Here's a map of our coverage areas for the California 988 centers. We formed a consortium in 2023 because we wanted to formalize the relationships we'd had for decades. And we saw this as an opportunity to really bring our expertise in the field of suicide prevention to the table at a time where there was both policy and implementation work happening statewide. Many of California's 988 centers have been running crisis lines since the 60s with the start of the peer support work. And most of us have been part of the National Suicide Prevention Lifeline since its inception in 2005. So this is work that we hold dearly, and we see our responsibility to our communities and the trust that we have built with our communities as a really key part of 988 implementation. Our partners at the HCS shared about increasing knowledge, and I think knowledge plus trust equals action. And the trust is where I think the 988 centers have done a good job in our respective communities. Next slide, please. In today's presentation, my hope is to give you a glimpse of what the work is like from the perspective of running a 988 center, and also the ways in which we have encountered the dynamics that we're encountering right now. I think the first and foremost is the number of help seekers reaching out has increased substantially, and I have some slides coming up with the actual graphs of that. And these are our neighbors who are experiencing significant distress right now. I'm sure you're seeing this in your own districts, you're seeing this on your staff, you're seeing this in your house. Like, watching TV is stressful. People's economic well-being feels threatened, and there's a direct linkage between economic well-being and crises. We've seen that in the past during the recession. We also have been exposed to ICE raids in our communities, to changing immigration policy, to our LGBTQ young people being targeted. And all of this is really contributing to people's sense of wanting to reach out for help. And we're glad that they're reaching out for help. I want them to be reaching out for help, but I also want to be able to show up for them when they reach out for help. And there are a couple dynamics that are resulting in not only there's been an increase in call volume, but our call lengths are getting longer. And some of that is because the acuity of calls has gone up. So that means there's more callers who are more suicidal or in a heightened state of crisis. Those calls take longer to de-escalate, to safety plan with. There's also the matter of follow-up care and linkage. Currently, the national standard for follow-up, which changed just 2 years ago, states that anyone who's had any suicidal thoughts currently or in the last 24 hours should receive follow-up care. That's an outbound contact from a center. Most centers in California are not able to offer follow-up care at that level right now. We are mostly doing follow-up care for medium to high-risk callers, which was the previous standard, due to the sheer volume of outbound calls required and the resources needed to meet the follow-up needs. And I think follow-up is really important. We take pride in the fact that less than 2% of our calls are ending in an in-person response. We think of the crisis contact that people make to us as an intervention itself. The goal is not the next thing. The goal is for that intervention to be complete. And in order for that to work, we need to be able to offer adequate follow-up to our callers and stay on the line with them as long as possible. Next slide, please. Some of the other dynamics that we're holding as people running crisis centers, as Ivan mentioned, is the SAMHSA funds running out, but there's also local implementation in terms of Proposition 1. Most of our centers have MHSA dollars that help our prevention and outreach programs that are not necessarily 988 picking up the calls, but they are supplemental to our 988 work. And a lot of those programs, because of their prevention nature, are slotted to run out, or that funding is in danger. So that's a dynamic that the centers are holding right now. So I imagine our reliance as a system on the AB 988 dollars is going to increase moving forward. There are some additional things that are important. When we talk about key performance indicators, I think it's easy to kind of zone out. But the key performance indicators are about people getting quality care. Our key performance indicators are about picking up calls in a speedy fashion. It's about having a high in-state answer rate, which helps us connect people to appropriate resources using the system that AHP is creating for resource and referrals. We're going to be able to connect people to those mobile crisis teams that are coming on board, to those crisis stabilization units that Stephanie talked about. But if we're not able to answer our calls in California, other states aren't going to be able to do that. So it's really important for us to keep our calls in California and have our centers responding to those calls. And the last thing is missed calls. Missed calls are people who are going to lose trust in the system. If you call 988 and no one picks up, are you going to call 988 again? That's a big deal. Like, that's literally what keeps us up at night. Like, you know, at my center, 10 p.m. to 2 a.m. are our hottest time, like most high risk, most calls. And there's nothing else available at that time. Who's someone going to call if they can't get through on 988? And also there's the practical matter of running a crisis center. With 988 becoming this big federal thing, there's so many layers of regulations. So the regulation to be an accredited center has increased. The training standards, the quality assurance, the supervision standards have increased significantly. And I think all of that is actually in the long term positive for the consumer, but in the short term, it requires a significant shift in the way we have historically operated our centers. Next slide, please. This slide here shows the October call volume, call and text and chat volume, so we call it contacts for all three combined, in California in October, the last 5 years. I hope it doesn't even require me to say anything, right? It just goes up. So the orange is text and chat, and the blue is calls. So they're both going up. Calls are going up more. And next slide, please. I zoomed in on the last 12 months here just to give you a sense. And this is directly pulled from the 988 National Dashboard. So this is not my slide. So a couple things to help you understand. The gray is important because those are our missed calls. And in the last 3 months, each month, we've missed between 4,600 and 4,900 calls. So those are people who called 988 and their calls didn't get through. Those are not people who flowed out of state. The flow to backup is the tiny red mark. Those are people who waited and they hung up because they didn't get someone. And I just want to hold them. Like, I think it's really impressive that we're answering so many calls in California. We're highest call volume, you said it. But it's also really worrisome that we're missing almost 5,000 calls a month. To put that in perspective, in 2023 in California, about 4,200 people died of suicide. And what if one of them had called us and didn't get through? And I think that's a reality that is hard to hold, so we often just talk about the metadata, but like those individual calls are actually like the world I live in. And just in the past 12 months, just because charts aren't always easily readable, this is a 40% increase in call volume, just so you're aware. And I think the only way for us to not constantly be chasing the call volume is to plan for it to grow, is to acknowledge that it's been growing for 5 years straight. It's going to keep growing. Let's plan for it to grow and build the capacity for it, because currently we see it growing. Our partners are responsive. They put in a budget request. The budget comes through a couple months later. We hire a couple months later. By then, I'm 9 months behind the call volume. And you know what? The call volume has grown again. So it's not that our partners aren't being responsive. It's just the system is growing at a pace that's outpacing all of us. Next slide, please. This one is our text and chat volume in California. The red is text and chats that flowed out of state, and the dark blue is the texts and chats that we were able to answer in California. Our current in-state answer rate is the highest it's been at 43%. So most texts and chats from Californians are going out of state. Again, this is making it hard for us to utilize the amazing behavioral health continuum that Stephanie talked about. I feel it. I've been running a crisis center for 13 years. I feel the behavioral health continuum getting stronger, like literally. And if people aren't coming to my center or going to centers in California, I can't connect them to that behavioral health continuum. And therefore, there's a gap that I want us to hold. Texts and chats, I think, threw a wrench in our planning because an average text or chat takes 43 minutes instead of the 12 minutes that a call takes. You know, I think it makes sense like the moment I say it, but it also surprised, I think, like our partners. And like many of us had text and chat, but it was at a much smaller scale before 988. And I think in order for all California centers to have 24/7 text and chat capacity, which they currently don't, there is a need for a major one-time investment or maybe like a 2-year plan of how do we get from 43% answer rate to 100%. Next slide. And this is my last slide. These are some of the barriers that we're currently holding. The AB 988 surcharge funds are just plain insufficient to meet the growing need and to help us expand to the degree that we need to. Just in terms of baseline funding, currently Cal OES receives a higher percentage of the AB 988 funds for the technology infrastructure than the centers do for the implementation of the 988 services. And from where we are sitting, it feels that our partners at HHS and DHCS don't have the funding they need to truly make this 5-year implementation plan. Like we have so many goals and we're not even picking up the phone all the time. Like it's really hard to imagine that leap without major investment. And the last thing I will say is like the infrastructure and technology, Steve spoke to it. There has been major delays. The goal was for all centers to be using this unified platform by July 1, 2024. And we're just noting that, you know, it makes it harder to do the work the way that is being envisioned in California right now, when the infrastructure that was supposed to be part of that implementation is not in place. And a part of that is even technology reimbursement. Our centers are mostly community-based agencies, and when we hire folks, we buy them computers to do this work. And none of us are yet to be reimbursed by Cal OES for that. Some of us have been waiting 9 months to be reimbursed. So these are some of the practical things that are in our way of doing this work, but I do think at its core, the AB 988 vision that California has is one that the whole country should be jumping on. So really grateful to work part of the system. Thank you.
Thank you so much. This has been some really powerful presentations and very enlightening.